Good day, everyone. I'm your host, Lee Judge, and welcome to today's webinar entitled Jacada Omnichannel Solutions for Healthcare, brought to you by Jacada. As a note, to honor the privacy of our attendees, only your name will appear in the attendee window. Our presenter today is Clay Davis, Product Solutions Specialist here at Jacada. Today we'll look at how to quickly offer a personalized and connected experience to your customers, and also how to seamlessly blend self-service with agent assistance across multiple channels. Following the presentation, there will be a question and answer session, so please feel free to type your questions into the Q&A window at any time. Also, as a note, once again, to honor the privacy of our attendees, only your name will appear in the attendee window. So let's begin. The presentation is all yours, Clay.
Well, thank you, Lee, and thank you, everyone, for joining. It's a real pleasure to speak with you today. We're going to be sharing a little bit about what we've learned in the omnichannel space for healthcare and share with you some of our solutions. Why omnichannel is important. What is the customer effort level that your current customers are going through when they deal with your organization? Why does this matter? We'll move from there directly into an omnichannel overview. What is omnichannel, specifically in the healthcare space? What are the Jacada solutions for omnichannel? And then we're going to spend a good bit of time looking at some of the specific use cases in healthcare, and we'll walk you through a demonstration for what that would look like in practice. And we'll wrap up with some case studies for large deployments of this type of solution. I hope that makes sense because we're ready to get started. So let's go ahead and jump right in. And I guess really the first thing I'd like to start with is to say that customer service and satisfaction really don't go hand in hand with healthcare. Whether it's a healthcare payer or healthcare provider, unfortunately, these organizations tend to be toward the bottom of the heap when it comes to customer sat. People typically associate healthcare with long waits, lots of paperwork, bureaucracy, all the things that kind of make people want to pull their hair out. With the advent of ACA and all the market-driven aspects of that change in the market, organizations are now trying to engage individuals directly, and it's a high-cost proposition. It's very difficult to sell, serve, and retain this population. And so what we're going to focus on today is how can you drive customer loyalty, which will help ultimately reduce your cost of servicing this population and drive up your revenues associated with it. The Customer Experience Board basically has done a good bit of work, and effectively what they said is this: trying to delight customers doesn't work. For the long time, we were all told we should be trying to delight customers, but nobody calls their healthcare payer or their healthcare provider because they want to be delighted. It's usually some problem that they're trying to contend with. They call Apple when they want to be delighted. They call their healthcare payer when they want to have a problem resolved. And so you can see on the screen some of the examples that actually increase customer effort. And what we found is when customer effort increases, this loyalty goes up. So it's very difficult to increase loyalty through customer service, but you can absolutely damage it through poor customer service by not providing the type of omnichannel experience that consumers are expecting and that they're getting through the other verticals such as retail and online electronics sales, for example. Unfortunately, the effort to reduce customer effort is not an easy proposition. There are multiple systems, multiple bureaucracies, many, many challenges to overcome. So today we're going to show you some ways that you can get started down that path. So ultimately, what's the objective here? We're trying to reduce customer effort, as I mentioned, and there's one particular area that organizations really struggle, and that is bridging the gap between the digital channels and the physical channels. There's some ability to move between digital channels, but inevitably, whenever I actually walk into the doctor's office or I actually call the contact center for the payer, inevitably, the type of experience I get is disconnected. Nobody knows what I'm doing. They don't know anything really until I give them a member ID number, and then all they know is what my claims history is, perhaps. So, we really want to focus on reducing customer effort across this barrier, across the digital and the physical channels. Of course, the end result pays enormous rewards. You're going to drive increased revenue when you have loyal customers. You're going to get an increased share of wallet. The retention follows, all the things that help you drive down the cost to serve customers. When you reduce the cost through faster resolution of issues, not only are you saving money for yourself, but you're saving time for your customers, and that's one of their most valuable commodities. So you're going to increase their self-service, which we know members and customers actually like to do when it's done effectively. You're going to drive faster resolution, and you're going to increase your sales and your revenue. All the things that, the top line executives are really looking for: driving sales, increasing loyalty, and the bottom line aspect of reducing costs, which of course tends to profitability. So when we talk about omnichannel, what does that mean? Everyone has a definition for it. Nobody, it seems, has really come up with a clear statement, certainly not in the healthcare space. So what we want to do today is really provide you a very clear set of criteria that you need to look at when you're evaluating how to move forward in an omnichannel environment. These attributes start with consistent and contextual interactions. In the healthcare space, that may be an example of, I go on the website to find out what a claim submission process is, but when I call the contact center, I get a completely different answer. And if I happen to be going through the IVR, maybe even the IVR directs me in a different place. That's a very common scenario. It's not unique to healthcare, but certainly we see that play out time and again. Another dimension is channel choice. What channels are you making available to your customer? And just as importantly, when are they available? If the only option to actually, resolve a claim is to call during business hours, then you're asking me to take time out of my work schedule to call on your work schedule. So, what other channels, what options are available to me, and when are they available? It's an important aspect of omnichannel. If you don't have the channels, obviously omnichannel is a meaningless statement. Here's a big one, and this goes back to the whole statement of customers don't like repeating themselves. Cross-channel continuity says I can start in one channel and I can transition seamlessly to another and pick up right where I left off. I'm not penalized for changing channels, and in fact, in some cases, I'm rewarded. An example of this would be I started in the enrollment process on the website, but I just couldn't find the doctor that I needed to make sure was on your plan, and so I called into the contact center. But when I reached the member services representative, their question was, who are you and why are you calling? Right? Yeah, maybe I know my member ID, and so that might tell you some, but if I'm in an enrollment, I don't have a member ID yet, so you're going to know almost nothing about me when you call into the contact center. Even in a pre-sales capacity, individuals are expecting you to understand what they're trying to reach you about and to understand what they've done up to that point. Another important point is collaboration. The ability to share information dynamically on digital channels during real time. Nobody likes to get on a call, establish what the issue is, and then find out they have to wait for a fax or send in a fax or wait for snail mail. The speed of business is such that nobody really is willing to wait for that length of time. You really need to look for a solution that provides you the ability to share artifacts directly with individuals across digital channels. Usability insights. It's key to understand how your members are engaging you, what channels are they working on, how are they changing channels, and perhaps most importantly, what are the friction points? What are the points that are causing them not to be successful in their self-service efforts, and where are they having to repeat themselves? And the last, and this is probably the biggest of all, is business agility. Everything that I've described up to this point can be done using existing technologies. However, it's always a lengthy, time-consuming, and expensive process requiring multiple man or person months of development by the IT operation just to implement one scenario. Forget about the fact of trying to manage interactions that span multiple channels where members are hopping back and forth between channels. Business agility really just doesn't exist today in the omnichannel world. We're going to speak directly to that and share with you some examples of how you can get started and how you can grow quickly on this omnichannel journey in your organization. and avoid some of the pitfalls that is so common when organizations make this attempt. So just to wrap up on the approach, we're going to help individuals manage hopping around between digital channels. We're going to help ensure that when an individual visits a health center or provider, or they reach into the contact center for a healthcare payer, we're going to drive first contact resolution, whether it's a sales engagement or whether it's a services engagement. We're going to do that providing the type of personalization and all the context sharing and the collaboration that you would expect when you engage with the 21st century organization. And as always, we're going to drive consistency, continuity, and choice. We're going to bridge the gap between digital channels and physical channels, and we're going to do that in a cost-effective way. So up to this point, I've kind of shared with you kind of the backdrop. I now want to shift focus a bit and share with you what is Jacada's approach to the Omnichannel challenge. Essentially, it's our interaction hub for business users. This is really the centerpiece for just about everything that Jacada does. It allows us to manage interactions across a number of platforms. And you can actually see here that whether it's a visual interaction on your voice channel or mobile customer service, all the digital channels, social, kiosk, Internet of Things, pretty much you name it, anything with a browser we can work with. And then, of course, on the sales side, you also need to engage people, whether it's on their smartphone or on their PC or tablet. So one of the critical dimensions, as we've said before, is you have to be able to manage interactions as customers start here and move to here, or actually, in this case, we're going to start on the sell side. And I want to make sure that I have a similar experience. It does me no good to create a great omnichannel experience on the sell side, and then when a member actually enrolls and they get into customer service, if they have to resort back to faxing and emails and snail mails just to get issues resolved, that's a bit of a bait and switch. So you definitely want to take care for both the sales and the customer service side as you go through this. And of course, collaboration. We've already said you absolutely cannot expect your members to fax you, email you. All the things that we're currently asking are really just problematic, and customers don't like it and really aren't going to tolerate it. They're going to move to the payer that can help facilitate this real-time collaboration. And as we also mentioned, the integration piece. You really need a platform that's going to provide you the ability to reach into your systems of record, whether that's your claims management system or your billing system, your scheduling system. All these systems contain rich business logic that if you can't expose into this interaction, you're going to be lost, and you're going to give the member kind of a threadbare experience. The Jacada platform nicely integrates using open standards, and we have rich 20-year experience of integrating with any number of systems, including some of the healthcare systems for claims management and such. So we know how to do this, and our platform makes this as painless and as simple as possible for your IT team to work with. And of course, as you would expect, we need to integrate nicely with all the voice channels, which we do, the Via Cisco, the rest. Even if you don't see your brand listed here, very good chance we've worked with it before, very good chance we can integrate nicely. All of this, the really guiding point is start small, pick the channels where the most pain are, both in the sales and the customer service, and initiate some of these digital interactions that allow customers to navigate between digital and physical, and make sure that that one experience, the consistency is there, and you'll be well on your way to delivering that omnichannel experience that we've discussed. So we've shared a little bit about the Jacada technology, and before that, why omnichannel is important. Let's actually take a look at what this means in practice in the healthcare space. And for that, we've come up with several use cases. One is a simple customer inquiry. This is a kind of a low value or low consideration. We want to reduce the cost to serve in this particular use case. We're going to look at an example of sales and basically member enrollment. We're going to look at a proactive notifications example and a channel hopping where a member starts in one channel and moves to the other, and we maintain that context. In all cases, or at least in most cases, we're going to be looking at a combination of transitioning from digital to physical or vice versa. We're going to look at inbound and outbound interactions, and we're going to see web, mobile, IVR, and voice all come into play. So we are really bringing in all the components of an omni-channel experience in some capacity, and hopefully as we go through these, you'll appreciate exactly what we've pulled together. Our first use case, as I mentioned, is the low-cost service. These typically take the form of basic inquiries and simple transactions, both for healthcare plans and providers. Typically, this will take the form of someone receiving a call. We're going to grab that call and we're going to manage that interaction using rules that the business defines. If need be, and that's an important if the customer self-serves, great, then you've reduced your cost to serve dramatically. But even if not, we're going to transition them seamlessly to an agent, and then we're going to facilitate the collaboration between the agent and the customer. So let's take a look at exactly what that would look like. I've prepared a short video that will walk us through this. I'm going to play this, and you should see all these steps coming into place. We're going to place a call, we're going to manage the interaction, and then we're going to transition it seamlessly to an agent. We're going to provide all the context of what the customer has done up to that point in the call. Let's take a look.
We're going to start our demonstration right where your customers normally do, and that is on your website, looking for your phone number. In this case, we're on the Jacada website, and you can see I found the phone number. I'm now going to dial the number on my iPhone, which you can see over here on the right, and we'll follow the prompts from that point. Now you can see that I've taken a call, an inbound call from a member, and given the member the option to convert to a digital and touch-based interaction, which we've done. I'm going to continue down the path of a member. Please log on with your member ID and password. Now, as a business, you can opt whether or not you want your users to authenticate at the very beginning of the interaction. In some cases, it may make sense to allow your users to access some material, such as the provider lookup, before they authenticate. In this case, we've elected to put it early, and of course, we can validate members, authenticate them against your backend systems as you would expect. So we have our member ID and password, we submit. And now you can see all the different reasons, the usual suspects. You can see the usual suspects for why members typically call a healthcare payer. The easy ones such as request ID and benefits, and you can see I can just jump right over and see the benefits for myself or my family members. And in this case, I really want to get into something a little more intricate, so we're going to look at claim status. Now, like most members, I don't know what a claim number is, but I do know roughly when the claim was submitted, so I'll go ahead and enter that date, range, the beginning and the ending date. And here we have the results for all the claims that fit those criteria. And you can see I get a very detailed description of my claim, something that is absolutely just not possible in the traditional voice IVR, either to search for that information and return it successfully or to display the level of detail that you would see here. In this case, I do want to speak to an agent. And now you see the beauty of actually giving the customer this omni-channel experience of no matter which avenue I want to go, everything that I've done up to this point is going to be made available to the agent, whether it's in chat, whether it's in a callback, or whether it's while I'm waiting on hold. I know that the work that I've done is going to help improve the call when I eventually do get connected to the agent. In this case, I'm going to elect to hold. So So I do have a few minutes, and it occurs to me that I probably do have some information I can share with the agent. So I'll go ahead and say exchange data with agent. And by the way, you can make this capability available any point during the interaction. I'm actually going to take a picture and send that up to the agent. I'll use an existing photo from my library. I think I have a picture of a printed circuit board. That'll work. Okay, and I've gone through, and over on the left side you can see the agent view, and we'll talk about that in a minute, but you can already see the picture that was uploaded for the agent to see. So I've now got collaboration going between my member on the phone and the agent in the contact center. So we'll go back to our post-call menu, and we'll wrap up with member-only offers. I look at this particular offer, it's not interesting to me, so I move forward. About 4 minutes has elapsed, and now I'm at a point where the agent is ready to pick up the call, and you can see all the information that's made available to the customer service representative. We gave the customer the option to navigate and self-serve on their digital device. In this case, the customer elected to connect to an agent, and now the agent can get the call started with all this information. And remember, one of our key points was continuity, the ability to move seamlessly between channels. So instead of picking up the phone and saying, who are you and why are you calling, I can now understand everything that the customer has done in this journey and make that information useful to begin the call on the right foot. That concludes our demonstration.
Okay. So hopefully you saw all the aspects that we talked about, the customer placing a call and being received by the IVR, managing the interaction and helping the customer navigate through some potential self-service options, but then when required, transitioning seamlessly to the agent. Now, I really want to focus on this area here, this collaboration between the agent and the member. You saw an example where the member could upload a picture. He could have just as easily uploaded a document or something like that. Likewise, the agent can push content back to the member. You remember the whole collaboration piece we were talking about. It might be that instead of faxing and waiting for someone to reply to an email, I can potentially send the content directly to the member over their digital smartphone or their computer, have them process that information right there while they're in the engagement and send it back to me. Back and forth collaboration is absolutely required, and it's absolutely available in our platform. So let's take a look at some of the other use cases. The other use case that I mentioned was proactive notification. And if you think about users with chronic illness, especially in managed care, it's very important to help members stay on top of their medicine, stay on top of their health, whether it's diabetes or asthma. We're going to take an example of an asthmatic getting an alert from, let's say, smog. Okay, and so we're going to start by, this process is going to walk us, we're going to look at it kind of abstractly first. The first step is defining the rules under which you want to actually engage that member. And then from there, you're going to send a notification. That can be an email, it can be a text, it can be an outbound voice call. Although I like SMS and emails over voice because you allow the member to interact on their time frame more than on yours, which is typically what a voice call requires. At that point, you're going to engage the member in the digital channel, and you're going to manage the interaction much like what we've shared before. And again, where needed, we're going to transition that member into the contact center if need be. And that's going to be a rules-driven approach, and you'll understand what I mean by that shortly. And again, we're going to update the agent with the relevant information. Now, you've probably seen this, you'll recall earlier that we talked about the slide where our interaction hub is going to manage the interaction from start to finish. It contains the rules around how an interaction starts and how it transitions across channels. We're going to show exactly, where we're going to integrate to the system of record, and the collaboration is required. So in this case, we're actually going to walk through just a slide example of sending an outbound notification. You'll notice that we can avoid a lot of the problems traditionally associated with SMS, mainly which is PHI and all the privacy and security concerns because we're not really putting anything secure or private in the notification. All we're doing is providing publicly available information and a link to an interaction that's managed by our Interaction Hub. Based on the member, we're going to show them information. I can embed graphics, I can embed surveys, I can request information back, I can put videos here. Everything that you can do in HTML5, you can basically do here in the interaction. Based on the rules that are defined here, I may decide that this is a high-risk patient and offer them the option to speak to a nurse, especially if they're symptomatic around their breathing. And so based on this, I've given a very contextual experience to my members, and I'm allowing them to connect to a nurse in the med management group, potentially, if they've got a caseworker, and pre-populate all the information in the med management system based on everything that the member has done right there in their smartphone or on their PC as an example. In every case, our Interaction Hub is managing. We're rapidly integrating with the systems, which, as I mentioned before, we've integrated with a number of the systems in the healthcare space, and we're going to facilitate real-time collaboration. So if this individual needs to upload biometric information or vital signs, as an example, that can be done and facilitated through our Interaction Hub. Another use case that we want to talk about is the channel hopping situation. This is a sales environment where a member is on your website and they're looking at your different health plans. Maybe they're looking at benefits and they actually plan to enroll. They're, as we mentioned, they're self-serving, but for whatever reason they just can't pull the trigger, and so they're going to call member services, or the enrollment hotline, I should say. And again, we're going to provide that digital guidance and, again, transition them into a sales agent as necessary. So let's see what that would look like. I'm going to start off as a member or a prospective member who's looking at your health plans on your website, and I see there's bronze, silver, and gold, and I've even gone so far as to drill down into the silver plan. That looks like the one that I want, but I just don't know for a fact whether or not my specific healthcare provider, maybe it's my pulmonologist or whatever, I just don't know if they're covered in this plan. So I decide before I sign up, I really need to speak with someone. Well, historically, the way that would work is I would click the Contact Us button, find a phone number, call, and when I actually reach an enrollment person, they're basically going to know almost nothing about what I've done. They might know that it's a call type of enrollment because they're mapped to that DNIS, and I'll probably know what ANI and maybe what state they're calling from, but that's about it. My agent script is going to say, hi, my name is John Watson, how can I help you? That is not the 21st century experience your members or your prospective members are expecting. Where are the caller details? What's the intent? What plans have I looked at? What things have I done already on your website? The traditional status quo doesn't answer any of those questions. Now let's take that same scenario from a Jacada perspective. We're going to start with that same website, but we're going to provide a Contact Us button, and when we click that, our customers are going to see contextual questions based on where they've been navigating and what they've been doing, okay? And in this case, I actually, I want to see whether the doctor is part of my plan, and now I'm offered all the different channels that this particular healthcare payer makes available to their customers, and we can facilitate the integration to these nicely. And I'm going to click Call Office. Now, the customer service representative, not only do they know that it's an enrollment call, and not only do they know the ANI, but they also know the name of the person calling. They know what their intent is. I'm calling because I want to know what providers are available. I see all the health plans that were shown to the member. I can see the one that they selected, and I can also see all the other things that they looked at on our website. Now imagine the difference for your prospective members when they call, and you can already jump to their point of concern rather than taking them through a full 1 or 2 minutes of asking questions where they've already provided the information to you in a different channel. That is the essence of channel hopping. I started on the website, I transitioned into the voice, digital to physical, I completely maintained context, I pick up right where I started, no effort lost. That is the essence of the omnichannel experience that we want you to share with your members. And as you would expect, we have caller intent, caller information, plan selection, navigation history, everything to get the call off to a great start. So before we wrap up, I want to share with you just one quick case study about some technology that we've actually implemented. This is an omni-channel solution for a major technology company. It has a lot of the same elements that you would expect in a healthcare environment, e-commerce support, product registrations, very similar to enrollment, store experience and connectivity, how do I get to the location, what are the hours, all the things that people call you about, they're calling this organization. And you can see some of the benefits that they've seen. We actually implemented this solution in 2 months. So when you're thinking about how do I actually get going with this, it is a very short time to market to make this work, and the results speak for themselves, both in terms of increased self-service and customer satisfaction. Just to give you a sense, in terms of reducing effort, here are some of the quotes from the customers in this particular case. And just to wrap up, the typical omni-channel experience will have an ROI of about 4 to 9 months in the case of member services, and you can see the different dimensions. And the same thing on the sell side, about 4 to 9 months. Hopefully you've seen through this presentation that Jacada has the ability to help you start down the path of providing a true omni-channel experience that reduces effort for your customers and that helps bridge the gap between channels, especially between the digital and the physical channels. And the results for you will be an increase in sales and reduce costs to serve your members. Thank you so much for joining today. I hope you will reach out to us at the information here and let us help you start down this journey for omnichannel for your members and for your customers. Thank you so much. Lee, I'll turn it back over to you now.
All right. Thank you, Clay, for your valuable insights on omnichannel solutions. Due to the high participation in the webinar, we're going to answer as many questions as possible from the Q&A window, and remaining will be responded to you individually after the event via email or a phone call. So I'll now go to the Q&A window, to the questions that have already been submitted. The first question is about IVR, Clay. The person asks, can I use this with my existing IVR?
Yeah, that's a great question, and the answer is absolutely yes. Jacada partners with almost all the major IVR vendors and have integrated with even a number of companies where we don't. It's low invasive. They're not dramatic technology changes that are required to the IVR. There are some programming changes that you'll want to blend the experience, but it's not a big lift in terms of the overall effort for your IVR, and it absolutely works with your existing IVR. We can leverage the existing logic, or we can use our drag and drop designer to build new logic to supplement your existing IVR logic. It's a great question and very common. We work with it all the time.
Okay. There's a few questions in the Q&A window about the presentation deck, and I'll be sure that if you want to get the deck, a copy of the deck today, then you can email me directly or Clay, or there'll also be a link on the website shortly also. The next question, Clay, someone asks, do I need a mobile app?
It is a great question, and the answer is no and yes. And when I say yes, you don't need a mobile app in any respect, but we do work with it. So the answer is we work without and with your mobile app. And what I mean by that is when we render our interactions, it's pure HTML. And for those who are non-technical, what that means is all you need is a browser. It doesn't matter if you've downloaded the app or not for whatever the healthcare plan or the provider. Even if you don't have it, we can provide a very elegant visual interaction right there on their mobile smartphone or their tablet or their PC. On the other hand, if you do have a native app and you want to integrate these capabilities, we provide the hooks to very easily integrate this right into your mobile app. And when you do, your mobile app basically achieves some of the benefits and capabilities of our visual IVR and our omnichannel solution, which is effectively the ability to transition calls back to the contact center or between other channels seamlessly. So the answer is yes and yes.
Okay, great. Clay, there's a few questions coming into the Q&A window, and we won't be able to get to them all, so I'll continue to pick a few. If you see one you'd like, be sure to jump in and interrupt me. But we want to make sure we get our attendees back to their busy days. I'll go to the next question that I see here. I think it's more of a clarification question. They say, I'm not sure I understood. Are you saying that if a person calls into your contact center, the agent can have a history or view of what the customer was doing in the web session? Can you elaborate?
Yeah, that is exactly the intent behind this. You'll recall that what we want to make sure is that when a member or a customer of any type is in one of your channels and then they move from a digital, which for example your website, web self-service, into the contact center, everything that they've done on that website is made available to the agent. And as a business, you decide what form you want that information to appear in. It can be a screen pop, very elegant screen pop like what we saw today with a vast amount of information. But we can also integrate that nicely into your existing CRM system so that your member information, the call intent, what plans they're looking at, all of that can flow nicely into your CRM system so that at the beginning of your call, you know, whatever application that may be is showing that member information right there at the very beginning of the call, and also what that member has tried to do up to that point. Very, very good question, very, very straightforward.
Okay, great. Well, Clay, once again, thank you for your valuable insights on omnichannel solutions, especially those particular to healthcare. This concludes our webinar for today, entitled Jacada Solutions, Omnichannel Solutions for Healthcare. If there are any questions we were unable to answer during today's session, please let us know. We'll respond directly to you for those that you've asked in the Q&A window and those that have been emailed to us. We'll respond directly to you after the event today. We hope you've gained valuable insight into our omnichannel solutions and how easily you can utilize them to enhance your organization's customer service. A replay of the event will be available soon on Jacada.com. If you'd like a copy of the slide deck immediately, please contact me at ljudge@Jacada.com. That's LJUDGE @Jacada.com, or Clay's email address is on your screen still. So you can contact Clay directly as well for a slide deck. Once again, thank you for attending today, and please visit us again at Jacada.com.